Welcome to Get to the Root, the podcast that's redefining what health benefits should be. I'm your host, Dr. Erica Armstrong, founder and CEO of Root. Here we explore the category we've created, root cause health benefits, a smarter approach that uses advanced lab screening and functional medicine to reverse chronic conditions and lower healthcare costs. Each week, we sit down with forward-thinking employers, innovative brokers, and change makers who are transforming healthcare from the inside out. If you're ready to move beyond sick care and build a healthier future, you're in the right place. Let's get to the root. Welcome back to Get to the Root. I'm your host, Dr. Erica Armstrong, and today I'm here with our lead dietitian at Root, Amy Masterson. Today's episode is about the newest dietary guidelines that were just released. And the idea for this episode came about as we had our monthly clinical meeting where the doctors and dietitians get together each month to discuss the latest in functional medicine and nutrition. This was a robust discussion, and we felt that this information should be shared with all of you. So welcome, Amy.
Yeah, thanks for having me.
So can you start by breaking down why the dietary guidelines matter and who they're meant to serve?
Yes. So the dietary guidelines for Americans matter because they really set the foundation for how nutrition advice is created and delivered across the U.S. From school lunches and meal programs to hospital meals to federal food programs, public health messaging, even how food companies market their products. So it just goes into a lot of things, and they are jointly developed by the U.S. Department of Health and Human Services and the U.S. Department of Agriculture. So that means that they influence policies and systems that affect millions of people. It's not necessarily just about individual eating habits. They're really meant to serve like the general population of our country with the goal of reducing chronic disease risk and supporting overall health at the population level. But I would also say that that is also kind of their limitation because they're designed to be broad and standardized, so they can't account for like individual needs, personalizing things, preferences, cultures, health conditions. Like there's just too many variables that go into this for each person individually. So it's really just meant to be like general population level.
Great. Thank you for that great overview. So in the big picture, what has changed with these new dietary guidelines?
Yes. So a couple things I want to point out. Number one, my personal media has just like blown up about this. I'm sure everyone's has, as it should. Food means a lot of different things to all of us, right? Like it's the nutrition piece, of course, probably biased towards that one, but health overall, culture, traditions, access, economics, it's really all of it. So people just have a lot of feelings towards these types of changes. But one thing to note is that there's a required 5-year review cycle for these. So this isn't like we redo these every year. We update them based on scientific evidence, shifts in population health. So we were kind of expecting new guidelines to come out. We were due for them. And yeah, that's why we're here with the 2025. It's 2026, but they're technically 2025 updates. We did talk about this as that clinical team. Everyone had great insight, and we talked about it forever, which is why we were like, let's put this on a podcast because there's so much to talk about. But in general, I would say, in our opinion, the biggest changes were, number one, there was more of a shift towards more protein and vegetable forward eating compared to previous versions of this. Mm-hmm. Yes. There's also a reduced emphasis on grains, I would say. Updated stance on dairy and dietary fat and added sugar. And then maybe the main thing was just this overall increased focus on eating real food. I think this has always been implied in our dietary guidelines, but we haven't just come out and said, eat real food as the first main focus of all of it.
That's a great breakdown. Eat real food. And that's what that quick visual is hopefully trying to emphasize. So what do we like about the updates?
So honestly, the emphasis on eating real food is probably the number one thing that we like the most. We talk about this at Root every single day, eating real food, whole, minimally processed foods. So our team agrees that this really is how we get healthier as a country. It's just harder than that. So unfortunately, it's not as easy as just saying eat real food. It's a very simple statement, but it's a very complex problem. So We like that about the updates, but it just means like there's a lot of work that we need to do to support this. We also really liked the recognition that most people need more protein. Recommendations for protein intake were very low. It was 0.8 grams per kilogram of body weight before, and now it's 1.2 to 1.6 grams per kilogram of body weight. So just acknowledging that we do need more protein than previously thought. And then also the acknowledgement of nutrient gaps if someone is not including animal proteins in their diet. That's just something that we've seen a lot over the years at Root with micronutrients. So it's just nice to see it being pointed out. It's not that you can't fill in those gaps. It's just good to know that those gaps can exist. Well, another big thing that we said was that there's just less fear-based messaging around dietary fat, like recommending full fat, no sugar added dairy, I think is a very positive thing. I keep thinking of an example of this, like the kids' yogurts that are flavored, that are low fat. They're not Greek, so they're low protein, and they just have added sweetener. It's basically like a cup of sugar. So just very hopeful to see maybe changes from this kind of trickle down to things like the school food programs.
Yes, make it taste better with fat, not sugar.
Yeah, exactly. We're getting there. The other thing we said was just this less emphasis on grains overall. So still choosing whole grain. We've always said that. And we don't want to get to 0 grains either. But like the OG pyramid back in the day, this is another note. A lot of people keep comparing this to the food pyramid as if we just went from one to the other. But it's actually been multiple years and multiple versions of using my plate, not even a pyramid. But nonetheless, the pyramid that we all think of when we think of the food pyramid had grains down at the bottom, right? So it was the biggest part of the pyramid down at the bottom. We were supposed to eat the most of that. And it's basically flipped with this one. Even the My Plate image that we have been using for the last over 10 to 15, I think it's been 15 years now, it still had grains kind of front and center in my mind. It was the upper right-hand portion of My Plate. And so that's just kind of where your eyes like naturally go to first. So it was just still, like I said, like front and center kind of. And this version kind of says like, okay, we're still including whole grains, but we need to focus on the protein, the vegetables more.
Yes, I know we'll get to this later, but in the Root plate, the right corner is protein. So can you kind of go in further and talk about this disconnect between the pyramid visual and actual recommendations?
Yes. So this is another, maybe one of our main concerns with the new guidelines. So with this switch from more protein and yes, more vegetables, but also to the full fat dairy and things like butter and different things, the saturated fat limits still remain at less than 10% of your total calories. So if someone is trying to eat in a way that like is including a lot of those foods shown in the visual, it's going to be very hard, maybe impossible, to keep your total calories under 10% for saturated fat. So it's just kind of this, there's a couple examples of like a disconnect between the visual that is very nice and what do the actual numbers in these guidelines say. Another thing that we talked about being a concern was fiber being underemphasized, even though it's so important and we know this. We know protein is important, which is great. We've got more of a focus on that now, but the fiber piece, like there's so many vegetables shown in that image, but then the recommendations for serving of vegetables stayed the same at 3 servings of vegetables per day. And like at Root, we recommend more like 2 cups per meal. So that would be way more than 3 servings in a day. So that plays into that fiber piece and how the numbers with the guidelines maybe don't line up exactly. And then we also were talking about where do legumes fit in here. So beans, peas, and lentils. After looking at the image for a while, there are some beans on top of a bowl of rice. So they are included, but they just seem like they're not focused on it all. And when we're talking about like choosing healthy, complex carbs, like legumes are going to be an absolute top recommendation. Fiber, resistant starch, vitamins, minerals. So might just be kind of missing a piece of it there.
Sure. And that's our preferred starch on the Root plate. Are those?
Yeah, and then exactly. And another thing is like when we think about blue zones, which were mentioned in some interviews with the administration, a lot of blue zones. So people who live the longest in areas around the world eat a lot of legumes. And alcohol was discussed and blue zones were referenced. But it's just interesting that That was mentioned with alcohol, but then the legumes are kind of left out maybe a little bit. So that was another concern that we had. Basically, the alcohol recommendations went from recommending 1 drink or less per day for women or 1 to 2 or less for men, and they took out those numbers and just said drink less. And that's maybe just not the direction that we need to be going with that. We know that there's no amount of alcohol that is healthy for us. And kind of putting all this together, I Googled dietary changes, I Googled the dietary guidelines changes, and one of the first articles that came up, the title was, "The new food pyramid puts meat and cheese at the top."
That's like clickbait a little bit.
For sure. But I was like, well, I just hope that our takeaways from this are not like meat and cheese at the top and no limits on alcohol. Like those would all be kind of steps in the wrong direction. But all of that to say, like, this is, again, general population. This is not saying this is what each individual person needs to follow exactly or that it can account for everyone. I think the two main bigger picture concerns that we talked about were application of these guidelines and then accessibility.
Right. The general message being there with protein and eating vegetables is great, but how do you apply that in real life?
Yep.
And that's where some of the visual problem of the pyramid falls short. Can you talk a little bit more about how you would attempt to apply these new guidelines?
Yes. So food pyramids definitely are hard to apply daily, real life, every single meal. It's helpful to show the overall eating patterns, which again is the purpose of the guidelines, but like we need to be able to actually show people how to do this. So how do you include all these foods in a balanced way that makes sure you're meeting all the guidelines and that works for you personally? Because nutrition always is going to need to be individualized. At Root, we've been using our visual of our Root plate for years. And using a plate method can help it be actually doable. Like you can see, like, what does my actual dinner plate look like and how does it line up with these protein and vegetable and whole grain and healthy fat? Like, how do all those things actually fit on my plate? So while the new guidelines and what foods are generally recommended do line up with what we recommend at Root, the Root plate just makes it easier to be applied. For those listening who have no idea what I'm talking about when I say the Root plate, I can kind of explain it quick. But basically, if you're looking at a dinner plate, a quarter of your plate is a protein source. A quarter, or maybe even a little bit less than a quarter, is a starch or a complex carbohydrate. So this is where we would put the whole grains. We would also put starchy vegetables. We would also put fruit here. Like a lot of things can count towards that carbohydrate that we want. And then having 1 to 2 servings or sources of healthy fat with every meal. And then half of your plate being non-starchy vegetables. So really that emphasis again on the protein and the vegetables, but thinking about it in a more visually applicable way.
Yes, thanks. And we have so many examples of a Root plate on our website, in our community, lots of resources for how to build your own Root plate for our members. The other bigger concern you had was accessibility. Would you like to talk a little bit more about this?
Yes, absolutely. This is like last, but definitely not least. Mm-hmm. At the end of the day, these foods need to be accessible to everyone. Like, that's great that we have these healthy recommendations to eat real food, but they have to actually be available and affordable. And right now, that is not the case. Right now, these foods are not consistently available for many people, or even if they are available, they're just simply out of their budget. So that just makes it impossible to try to do this. We need to make sure that now that we have these updated guidelines, that the policies and the subsidies that follow like actually support them. That is the purpose of the guidelines. So that is ideally what should happen, but that's really what we need to be able to have these guidelines actually make our country healthier.
And the second part of that, maybe even if people are able to get these foods, a lot of people struggle with knowing how to prepare them and fitting that into their lifestyle.
Yes, absolutely. So even if people are able to get these foods, so step 1, do that. Hopefully we'll get there for everybody. But a lot of people just don't have the time needed to like prepare everything from scratch. So this is something that like our team of dietitians are talking about all the time with our members. How do we do this? Prepping things, making easy recipes, using frozen items. The guidelines do recommend things like using frozen produce as well, which is great. But it really comes down to individualization and meeting people where they are.
Yes, such a great point. And in functional medicine, we do so much individualization, so many personalized diets, whether that's for histamine or food sensitivities. And so really, as you said in the beginning, these are broad guidelines for an overall statement of what's important in the diet. But what it comes down to is that individualization and what we do at Root for each person. Can you give us a couple of practical takeaways?
Yeah. So I guess one thing I forgot that I wanted to share after meeting with our clinical team and talking about this, one of our doctors made a great point. She said, if you look at the visuals, from 2010, 2020, now 2025, it's really the stuff that doesn't even make it on to the pyramid. That's the problem. So I do want everyone listening to be able to just remember that. We don't want this to be stressful. And if you're eating a lot of the food shown in that visual, then you're on a really good track, and maybe a dietitian can help individualize that for you a little bit. But it's the stuff that we don't even show, right? The kind of the junk food that doesn't even make it on there that is causing most of the problems, most of the health concerns in our country. And then again, I would just say yes to eating real whole foods whenever you can, and focusing on protein and fiber and lots of vegetables and plants. But just don't let these new guidelines be overwhelming. There are small changes that can be made to work towards this goal, and a dietitian can always help individualize this for you.
Great. Thank you. So with that, Root has a clinical team of dietitians and doctors who talk through changes like this together, both for our individual members and in our group settings. And we feel at Root that nutrition should always be individualized based on health concerns, your lab biomarkers, and your health goals. Thanks for listening. Thanks for being here, Amy. Until next time. Thanks for listening to Get to the Root. If you enjoyed today's episode, be sure to subscribe and share it with someone who's ready to rethink healthcare. You can learn more about Root Functional Medicine and our work with employers at rootfunctionalmedicine.com. We'll see you next time, where we'll keep challenging the status quo and getting to the root of what really drives better health.